The pain here in the patient radiates to the side, such as, here is the gluteus medius. Does it hurt? Right here. Yes. The buttock. Then here. Here. Then here is the quadratus lumborum. It's right here straight. And is it painful up here? Here is the extensor, along with trigger points and tenderness. And now we are specifically accessing this muscle here, here, and usually also here at the attachment point of the quadratus lumborum in this region. So 1, 2, 3, 4, 5. This is only in the area of the lower back and sacrum 6, because the muscles of the spinal extensor attach here to the broadness. What does the quadratus lumborum do in the lumbar region? She performs a water flexion, meaning she bends her torso to one side, then to the other side, and again to the other side. When a person bends here, it should stretch, but since it is shortened and compressed with trigger points, when the torso moves to the left, it stretches poorly or not at all, and she struggles to perform lateral flexion in that direction. Also calmly. Also, there should be good mobility here. But when the quadratus lumborum is shortened, these normal movements do not occur, including this rotation. It also causes pelvic tilt, as it attaches to the pelvic bone and shortens, pulling the pelvic bone in that direction, resulting in pelvic distortion and also shortening of the leg. One leg is shorter than the other. Various manual therapists and osteopaths try to adjust the leg, but this is impossible because the quadratus lumborum is shortened. The lumbar muscle, when it shortens, is located beneath the rectus abdominis and creates the impression of a short leg. It will be impossible to correct. It is necessary to treat the quadratus lumborum, relax it, eliminate the trigger points, and remove the fibrosis. We also need to treat the gluteus medius and gluteus minimus, which we will focus on now. I will repeat once more. The sacrum, spinous processes of the vertebrae, notably the iliac crest. The last rib, pain in the area of the sacrum, right here. The pain is here and there, gluteus medius and further down the leg. Here. Then, well, we have the piriformis muscle, right? We know that. This is how it goes, yes, well, it goes approximately like this. Here too, also. Trigger point, yes. And it will hurt here. Right here exactly. And it will hurt here precisely. Then, the extensor of the spine. And the iliocostalis muscle. Here is a trigger point. Here, and already inside under these muscles, is the quadratus lumborum. 1 trigger point, 2 trigger points, 3 trigger points. We are working, performing therapeutic massage. We are saving the battery. That's it. And little by little, gradually, without extreme fanaticism or aggression, therapeutic massage is performed in a measured way. And first, it is absolutely necessary to create maximum hyperemia. This is one. What is hyperemia? It is the local influx of blood, and with the blood, internal medications, pain relievers and so on will come. You cannot perform deep tissue massage immediately. Pressure is not allowed. The muscles are already stiff, hard, and stone-like, and there are painful areas. I have already pointed out a bunch of trigger points. And if you immediately tighten them, if you do not warm them up with massage, whether it is regular massage, unusual, sports, or any other, and do not create hyperemia, the influx of blood, along with medications, endorphins, and other internal medicines, it will be harmful.
the central nervous system will strongly rebel against, and the brain will not want to come for the next procedure, such as, for example, that's why I often see videos where the guys who practice pressure therapy, as it's called, start pounding with their elbows right away, without preparation. You can't do that. You can't do that. This is a therapeutic massage. It is done in a dosed manner, just like with medications. The doctor prescribes medication and says, you start with 1/4 of a tablet and then we increase it. It's the same here. It doesn't matter in which direction, lymph flow or lymph influx, everything is so compressed here that the work of the lymphatic system is hindered because the lymphatic vessels run parallel to the blood vessels. Both those vessels, such as, are located in the muscles and fascia. And when the muscles and fascia are rigid, stiff, and in a state of hypertonicity and tension, the direction of lymph flow no longer matters. Instead, our task is to slowly and steadily break down and gradually eliminate these problematic and fibrotic areas and trigger points deep within the body, and thereby initiate the process of tissue regeneration. The area to be worked on for treatment today is the quadratus muscles. Here we also have the extensor and the gluteal muscles, and we will slightly engage the piriformis. The pronounced hyperemia is already a good sign, so we can now start a little deeper. The patient feels some pain, so let's slightly bend the leg. It is painful. Let's warm up again. Just a bit. Again. A little. Let's squeeze. A bit. We are pressing down, but we gradually increase. Gradually increase. We try to go back to the gluteal muscles. The middle, small, can alternate and versatile. Such massage movements and already deep tissue, myopressure movements. These techniques are designed to relieve tension and improve circulation, providing a comprehensive approach to muscle relaxation. Since the person has endured, we will start again. We will work here once more again. The middle gluteal muscle is fibrosed, and the small gluteal muscle as well. That's it. And again, we just let the patient relax a bit more. There, here as well. Pressure movement. And again, we let it relax. You cannot work at 60-80% right from the first or second procedure. Right now, I probably conduct therapeutic massage about 10% of the time. I do warm it up a bit more, but that's enough to make sure it is just right. There is absolutely no further requirement for anything else at this point. Do you understand what I mean? It is crucially important to understand that pain in the lower back and sacrum area cannot originate directly from the sacrum itself, nor can the vertebrae or herniated discs directly cause pain. In approximately 95% of cases, the pain experienced in the human body is primarily due to muscles that are in a state of permanent hypertonicity, experiencing constant tension 24/7. The primary and main source of pain is formed in trigger points, which are also commonly referred to as muscle knots or nodules. The subsequent next stage is myofibrosis of the muscles, which occurs when these trigger points are not adequately treated, leading to increased hypertonicity and the prolonged formation of trigger points in the muscles, causing them to begin to degenerate and transform into cartilage and bone. This is called myofibrosis. The middle gluteal is cracking here. This is myofibrosis. This is when there is a gradual and progressive deterioration of muscle tissue and its slow and steady transformation into connective tissue. Let's press a little like this. But it's already bearable, right? If I had started doing it like this right away, it would have been unbearable, and the procedure would have ended. The procedure would have ended. Here, where the gluteus medius and gluteus minimus are, I am not working with my elbow for now, as it is quite painful. Dear friends, if you have been experiencing persistent pain and discomfort in the lower back and sacrum for a long time, the only truly effective and proven treatment in the field is deep tissue medical therapeutic massage using myopress. No other methods or options work. Neither osteopathy nor manual therapy, nor kinesiology nor neurology. They do not treat pain, chronic pain in the back, in the lower back, since they do not typically address the underlying cause of the pain. And the main cause of the pain, in particular here in the lumbar region, will be addressed. Gluteal muscles. These are the muscles that are overloaded, which are in constant tension, and it is necessary to treat these muscles. To treat lower back pain, it is necessary to treat the muscles of the lumbar region. The quadratus lumborum muscles, the extensors, and the rib muscles are involved here as well. But now, we are talking about the quadratus lumborum muscles of the lumbar region. Both the gluteus medius and the gluteus minimus muscles. There are no other ways, dear friends. Look for specialists who treat myofascial syndrome, which is indeed a muscle and fascia disease, and perform proper therapeutic deep tissue medical massage using myopressure. And you will certainly be healthy, happy, and everything will be well. This was indeed Pavel Essi. I live and work on the island of Phuket and engage in real treatment for back pain. Be happy. Subtitles by Dima Torzok.